A very good morning, everybody. Today we will discuss in brief about the small intestine and the large intestine. As you all know that the small intestine and the large intestine, these are the parts of the digestive system. Now, what does this digestive system do? The purpose of digestive system is to change the foodstuff by mechanical and chemical action to simple form, to absorb easily into the blood and utilize the various tissues in the body. Now, when you see the process of digestion, we have different steps in digestion. Number one, we will have the ingestion, digestion, absorption, and excretion. These are all the different things we will study later. Now, today's topic is we will discuss about the small intestine and the large intestine. Now, what is the small intestine? The small intestine it extends from the pyloric end of the stomach to the ileocecal junction, and it consists of the fixed part which is called as duodenum and the remaining mobile part which includes jejunum and ileum. The total length of that small intestine is about 6.5 meters, and the small intestine is very essential for life because most important of digestion and absorption takes place in this small intestine. As I said, this small intestine has got three parts. Number one is the duodenum, number two is the jejunum, number three is the ileum. Duodenum is the fixed part and jejunum, ileum, these are the mobile parts. And now we'll discuss about the duodenum. Now, the duodenum is the proximal dilated and fixed part of small intestine, and it is devoid of mesentery. It is a C-shaped curve which encloses the head of the pancreas in it, and it is subdivided into four parts. It has got the first part which is 5 centimeters, second part which is vertical and it is about 8 to 10 centimeters, third part which is horizontal which is about 10 centimeters, and lastly it has got the fourth part or ascending part which is about 2.5 centimeters. The second part is most important part of the duodenum, so we will discuss in detail about it. The second part of duodenum, it is about 7.5 centimeters long and it is descending part. Next, it begins at the superior duodenal flexure as a continuation of the first part opposite to lumbar 1 vertebra. The second part passes almost vertically downwards in front of the hilum of the right kidney along the right side of the vertebral column, and it ends at the inferior duodenal flexure opposite to the lower border of L3 vertebra, and it bends to left side as in continuation with the third part of the duodenum. Now, the relations of the second part, if you see, anteriorly the second part of the duodenum is related to the to the right lobe of liver, and then the fundus of the gallbladder, transverse colon, and few coils of the jejunum. Posteriorly, the second part is related to the anterior surface of the right kidney, right renal vessels, right ureter, right psoas major muscle, right edge of inferior vena cava, and also sometimes the right suprarenal gland. And laterally, the second part is related to the right colic flexure. And when you see the medial relations of second part, medially the second part of duodenum, it is related to the head of the pancreas. Not only that, the inferior pancreatico-duodenal vessels, then you will have the bile duct, pancreatic duct, okay. All these are related medially to the second part of the duodenum. Now, the interior of the second part, once if you cut open the second part of duodenum and the inner side of second part of duodenum, you will see some features like circular folds which are called as plica circularis, and these are the permanent folds which you see within the duodenum. Next, we have the major duodenal papilla, which is a conical projection arising from the posterior medial wall of the second part, and this major duodenal papillae, it presents a orifice through which the bile duct and the pancreatic duct opens into it. Next we have one more papilla which is called as minor duodenal papilla. This is a small conical projection which will allow the accessory pancreatic duct when it is present. These are the three major things you see here. So circular folds which are called as plica circularis, which are permanent mucous folds. Then we have major duodenal papilla onto which we see the opening of the bile duct and the pancreatic duct, and we have minor duodenal papilla onto which we see the accessory pancreatic duct when it is present. Along with this, you also see some other structures like plica semicircularis, which arches above the major papilla, and we have the plica longitudinalis, which is a vertical fold extending downwards from the major papilla. So these are the features which we see in the interior of the second part of the duodenum. The relations of the third and fourth part are given in the slide. I request you people to please go through it very carefully, the third part and fourth part. The most importantly, one should know about the second part, its extension, its relations and its interior, and the third and fourth part relations were given in the slide, so please go through it. Coming to the blood supply, here the arterial supply, if you see, the most of the duodenum except the first part is supplied by the anastomosis of superior and inferior pancreatico-duodenal arteries. Okay, and nextly you should know about the venous drainage. The veins corresponding to the arteries and drain into superior mesenteric vein and into the portal vein. Coming to the nerve supply, the sympathetic innervations are derived from the celiac and superior mesenteric plexus, and the parasympathetic nerves are derived from both vagus nerves. This is all about the blood supply of the duodenum. Coming to the applied anatomy, the first part of duodenum is vulnerable to the formation of the peptic ulcers since it is supplied by the series of end arteries. Sometimes the gastroduodenal artery passing behind the first part is eroded by the peptic ulcers, producing the severe hemorrhage. Next is the second part is most protected from the external injuries since it is behind the curvature of the vertebral column. And not only that, we have other things like duodenal ulcers. Duodenal ulcers are the most common in the first part of duodenum due to the following reasons. Like the stomach empties its acid chyme into the first part of duodenum, it results in the ulcer. Okay, the arteries supplying to the first part are said to be end arteries, and a block of these vessels lead to necrosis of the mucosa and form the ulcer. Okay, these are all the reasons why the duodenal ulcers are formed. Now coming to the other parts of small intestine, the jejunum and ileum. Previously we discussed about the duodenum and the other parts of the small intestine, which is the jejunum and ileum. Now the mobile part of the small intestine extends from the duodenojejunal flexure to the ileocecal junction and arranged in series of coils and suspended from the posterior abdominal wall by the mesentery. Okay. Now the proximal 2/5 of the small intestine gut forms the jejunum, and the distal 3/5 is known as the ileum. The beginning of the jejunum and ending of the ileum are parallel to each other. Next, the length of the jejunum and the ileum is, if you see, they are about 6 meters, or if you want it in feet, it is about 20 feet. In this, the jejunum is 8 feet and the ileum is 12 feet. Okay. Next, when you see the what do you call the differences between the jejunum and ileum, the jejunum, the tube is wider, whereas the ileum is narrower. Next, the wall of the jejunum is thicker, the wall of the ileum is thinner. The color is red due to increased blood supply in the jejunum, whereas in the ileum the color is paler due to the poor blood supply. Then the presence of fat in the mesentery is less in case of jejunum and more in case of the ileum. The presence of lymph nodes are less in jejunum, more in ileum. Next, we have the villi. The finger-like projections are long and abundant in jejunum, short, thin and less numerous in the ileum. The Peyer's patches are present in ileum and absent in the jejunum. These are the small differences between the jejunum and the ileum. Next, the arterial supply. If you see, the arterial supply of jejunum and ileum, they are supplied by the branches of superior mesenteric artery, which is a branch of the abdominal aorta. Okay, and the nerve supply is by the superior mesenteric plexus, which contains the sympathetic fibers arising from T9 to T10. And the lymphatic drainage of jejunum ileum will be drained into the intestinal villi, and which are the plexus of the lymph vessels in the jejunal wall, and from these they move to the mesenteric lymph nodes and ultimately into the superior mesenteric lymph nodes. These are all about the differences, the blood supply, nerve supply and lymphatic drainage of the jejunum and ileum. Thank you.